Good afternoon, everyone. We would like to welcome you to the Lincoln Auditorium this afternoon, and to all the many Idahoans who are watching this stream from their homes and offices across the state, welcome. We come together today to celebrate Mental Health Awareness Month in Idaho. Awareness is an idea, a suggestion, but today you're going to hear about action. Real work being done by the state of Idaho, the Department of Health and Welfare, and our many partners across the state. Many people in the state are suffering from mental illness, substance use disorder, co-occurring complications, and all of the Idahoans who seek better mental fitness in their lives. We celebrate today not in exaltation, but with determination. It takes many hands to get Idahoans the help they need when they need it. We've identified many gaps, many needs, and with the help and the support of the people in this room and across the state, we will continue to fill those gaps, meet those needs. And again, we thank you and celebrate you and welcome you. And with that said, I'd like to introduce Ross Edmonds, Administrator for the Division of Behavioral Health.
Hi, thank you very much. Again, I'm Ross Edmonds. I work for the Department of Health and Welfare in the Division of Behavioral Health. And I'm going to share a few of my own words here in just a couple of minutes, but first I have the pleasure of introducing Governor Little to you all. Governor Little has led Idaho through unprecedented improvement and progress in the area of behavioral health. He particularly has a very strong focus in this area and has taken several steps towards improving that system, including the Idaho Behavioral Health Council and the work that they're doing. So I'll share more of my thoughts in just a minute, but it's my honor to introduce Governor Brad Little. Thank you.
Well, good afternoon. We have done a lot in this area, and to everyone that helps, what organization, what community, what interest group, thank you, because this is nothing that can be done. We are the only state in the nation where the executive branch, the judicial branch, and the legislative branch are co-equal partners in making recommendations. And of course, Ross and the Department of Health and Welfare are a big part of that, about everything that we do for mental health and wellness. The vision that I believe is united in the state is that that all who live with mental illness and addiction and their families will receive the services they need when and where they need them. And we believe that this vision is realized when our communities become healthier and safer place. We've made incredible strides. I often state that we're making great progress, and thank goodness we started when we did, but it seems like the problem almost grows at a faster rate than what we're doing. We address one problem and another one comes up, and particularly a lot of it is what we do to scale it out. In the last couple of years, we opened psychiatric residential treatment for Idaho children so we can bring them home. It wasn't very long ago that our kids that needed that, excuse me, I was just the Speaker of the House, I'll just not take this call. I thought you'd find that humorous. But you know, it wasn't very long ago where we sent those kids to Georgia. But again, it was a Behavioral Health Council's recommendation that we now have 4. Have we got them all open? Three open, and another one around the state, which is a big part of it. You know, we put in the crisis centers. We've got continuous funding for the recovery centers, but the issue really for us is how do we scale it out to rural Idaho? In the last day or two in my office, I got a letter from the clerk in Salmon. And one of the things that we do is we go around the state and go to these rural communities. I was in Idaho City last Friday, and we go to communities, and I take a good share of my cabinet, including the Director of Health and Welfare, and we listen to people's concerns. And this letter from the city clerk talks about, we had Capital for a Day in Carmen, Idaho. That's a big suburb of Salmon, if there are big suburbs in Salmon. And they asked a question about it. And since, in the ensuing 6 months since that period of time, the clerk talked about what they needed was for their law enforcement to be trained for crisis intervention team in Salmon. And the letter, I just showed it to Ross a second ago, they were proud to say that on April 12th, some of their city officers and county deputies were certified as crisis intervention teams to service that very remote area. And they were paid accolades to Ross in his department, but this is what we need to do. Whether it's straight mental health or whether it's substance abuse, addiction, we need to continue to scale this out all over the state of Idaho. And the legislature's been a good partner. After we did our report on behavioral health, we aggregated all the resources that were being spent by all the areas of the state. At that time, it was about $250 million, but we're much more coordinated in what we do going forward. I remember not too long ago when our suicide hotline wasn't even based here in Idaho, and when it was just a suicide hotline. We went out and took our remote suicide hotline, brought it into Idaho, and now it's a fully staffed 988 as part of the national 988 network, and it's doing great work in the state of Idaho. Our safe teen reception centers that we're putting all over the state are the place where faith leaders, teachers, family members, law enforcement, if they've got a teen that's really had a challenge, they've got a place to go. And I've seen the great work that's being done in that area. And of course, a big thing that we got through the legislature this year is our new mental health facility for the dangerous and mentally ill that were before now were incarcerated, not with, but in an area where it was a incarceration facility. And we tried last year, but we had great support this year, and I appreciate all the legislative support. And we're bidding that out, I think, aren't we, Jared? I think right away. So I am grateful to our partners in the legislative branch and the judicial branch, because full disclosure, it was the judicial branch that really brought this idea to us originally. We had a little COVID incident in between that perhaps kept us all occupied for a while. But they've just done a lot of great work, and I'm very proud of that. So with that, I have an official proclamation from the office of the governor. Whereas mental health impacts the well-being, quality of life of each Idahoan is integral to building and maintaining a meaningful and joyful life and thriving communities. And whereas the state of Idaho is transforming and improving Idaho's behavioral health system through the Idaho Behavioral Health Plan. And whereas the Idaho Department of Health and Welfare Division of Behavioral Health Adult Mental Health Team have provided services to nearly 10,000 Idaho adults in the state in this fiscal year. And whereas every Idaho county is a health professional shortage area for mental health, and rural communities are significantly impacted. And whereas health services contribute significantly to disease prevention and management and play a vital role in supporting state and local economies. And whereas recovery and hope are possible for those living with mental illness, and Idahoans and their family members deserve access to affordable care and treatment. And whereas education and awareness about mental health conditions and substance use disorders decrease the stigma and promote a culture of compassion and understanding. And whereas providing access to mental health care supports the well-being of all Idahoans and enables individuals to be productive members of their communities and saves taxpayer dollars by preventing unnecessary usage of emergency service and results in lives saved and brighter future. Now, therefore, I, Brad Little, Governor of the State of Idaho, do hereby proclaim May 2024 be Mental Health Awareness Month in Idaho, and I encourage all Idaho citizens to recognize this special observance. Signed, Brad Little. Here you go, Ross. You're in charge. I think I just threw your script on.
All right. Well, thank you, Governor. Thank you for signing the proclamation. It reminds me of a story. I heard a story once when I used to work a lot more in just specifically the area of suicide prevention. And in the Air Force, there was a really bad outbreak of suicides in the Air Force. And they implemented a new program. And within about, just like 5 years, they almost cut in half the number of suicides that were occurring. And when asked what helped that, what created that change, what they identified was it was the chief of staff. It was the Air Force leadership coming out and saying it's a strength to access mental health care. Because if you think about the environment, strong, pull ourselves up by our bootstraps, we shouldn't have to ask for help for mental illness. And I think of the same thing here. When our governor speaks, he speaks with so much compassion about behavioral health and mental illness in the state of Idaho. And that's what will make a difference here, is starting from the very top of this system all the way through is the amazing support that we have related to this. So anyway, I want to talk just really briefly. For many years in Idaho, we've been, I used to call it a bifurcated system, meaning that it's in two different pieces. Really, it's been completely fractured, right? It's not just two pieces. It's been fractured beyond that. Fractured between the Division of Behavioral Health that I work in and Medicaid, fractured between the court system and the law enforcement system, politically fractured between the support from the legislature and the executive branch, including the governor. And those things create such challenge because it creates duplication and it creates competition within the system. And over the last several years, what we've really been able to do is to help repair so much of that fracture. One of those things is what the governor spoke of, and that was the creation of the Idaho Behavioral Health Council. That took the three branches of state government, executive branch, legislative branch, and the judicial branch, brought them together to create the Idaho Behavioral Health Council. The governor did an executive order that created it. The Supreme Court Chief Justice did a proclamation, and a concurrent resolution was done by the Idaho legislature, which created that. And they came, they studied the system. I've been a part of, just way too many times have I been a part of something like that, where the system is studied, there's a set of recommendations, and it becomes this revolving door, right? So study, make recommendations, and those recommendations are handed off to the next group who does their own study and makes their own recommendations. Nothing gets done. It just is this revolving door. So we didn't create with Idaho Behavioral Health Council a strategic plan. We created a strategic action plan. And we have achieved nearly 100% of the prioritized, that some of them are near complete, but we've completed almost 100% of the items that were identified in that strategic action plan. But more to come. The governor just signed a new executive order recreating that council, and they're beginning their work right now around creating the next iteration of the strategic action plan. So that's where we are. The other part that I mentioned was the fracture in the way the system works between if you have Medicaid or if you don't have Medicaid, right? So historically, the way our system has worked is if you have Medicaid, you receive your services through a Medicaid provider. You have a doctor there, you have a counselor there, therapist, you have a case manager in that system. Well, if you then get a job, stabilize, get a job, have some income, well, now you don't have Medicaid anymore, right? And so you lose those resources in the relationship with all that treatment team that's been so helpful to you, and now you have to switch and come over to potentially the Division of Behavioral Health and see a new doctor and a new case manager and a new therapist. So what we've done in the state of Idaho here over the last couple of oh man, we've been working on this a long time, but is to create a new Idaho behavioral health plan that really brings those two pieces together. It's one managed care approach across both Medicaid and non-Medicaid. And so I'm very grateful. I won't steal the Dustin's thunder. He gets to do the introductions, but next you'll hear about that plan and the amazing partner we have in implementing that plan in the state of Idaho. So with that, Dustin, I'll let you introduce our special guest, David Welsh.
Right, thanks, Ross, and thanks again to the governor for coming to speak today.
Good afternoon, everyone. I'm pretty sure that was my speech that the governor knocked on the ground, and Ross just read it. But I'll pivot here a little bit. My name is David Welsh. I'm the executive director of Magellan of Idaho. Really excited to be here this afternoon, see so many folks, some of my behavioral health professionals that I've worked with for years. As Ross had indicated and the governor indicated, mental health is evolving so quickly, and it's hard to keep up with everything that's going on. At times, it does seem like the need is growing faster than what we can do. Being part of Magellan here, I'm really excited to try to execute the path that the Department of Health and Welfare and the governor and all of the behavioral health professionals in Idaho have put forward in the contract that we hold. I think that this contract is innovative, and you know, when we talk with other individuals around the nation about what's being done here in Idaho, I think it's pretty impressive to be paving the way in how we're looking at funding and taking care of our Idahoans, our friends, our families, our neighbors, creating awareness, creating access. But as part of this program, we're able to look at the individuals holistically and figure out how we can best support their needs and get them connected with other resources and get them employed and stabilized in the community. So three of the main components, I think, of this contract are the way that it's evolving from the current Idaho Behavioral Health Plan that's administered by Optum. And we're really looking to build on what they've created here in Idaho and continue to execute the vision that's put forward in our contract. And you know, it's a passion of ours at Magellan to really, you know, provide behavioral health services, quality services, access to services, meet folks in the community, keep them in the community. But as we're looking at doing so in understanding the vision of the Department of Health and Welfare, the vision of Medicaid is a key partner in bringing the Medicaid resources to the table. Mr. Edmonds and the other state funding aspects of behavioral health care for adult mental health and children's mental health, and also our partners at juvenile corrections. I think that we're really excited to be the focus point that can take all of those resources and try to provide the best care we can to Idahoans. Again, understanding that there is a great need out there, and a lot of times, you know, there's the perceived stigma of accessing behavioral health, and I think COVID really did change that for the positive. I think it's become more acceptable to go out and see a therapist and talk to someone about your challenges. I mean, I think everybody in the room today has had a day where they're like, gosh, I could really vent to someone or seek some help and guidance. And it is Magellan's vision and the state's vision to create an environment where you're able to go out and express that need and then access that need. And I think we're here to try to create a network that's sustainable, that's quality. You know, the network today is done so many great things, but we want to continue to enhance it, you know, as best practices are evolved within the United States and elsewhere. How can we continue to help provide the supports for network providers to give the best services that they can to, again, our friends, families, and neighbors. So I'm really excited to be part of this vision. And again, you know, I look around the room today, and I know some folks couldn't be here today, but there are just so many great people that are passionate about creating awareness and serving our fellow Idahoans and doing things the best way we can to ensure that folks can live productive and vibrant lives in the community. And it is just an honor and a privilege to be standing here today speaking to you all. And again, I want to recognize Juliet Sharon and again Ross Edmonds are key colleagues of mine that I really respect a lot and appreciate, you know, coordinating and collaborating with them on what the Idaho Behavioral Health Plan will look like in the coming years. So we're again excited to be bringing the integrated aspect of behavioral health. We're taking the outpatient services that are currently administered under the Idaho Behavioral Health Plan and bringing in the inpatient services that are not managed under the Idaho Behavioral Health Plan the other state funding services, residential treatment for substance use disorder, psychiatric placements for kids, and bringing that all into one service delivery system where Magellan can hopefully act as a conduit for providing coordination of services, support to our network providers, also serving our first responders as they're called out to need, and how we can create mobile response teams that serve Idaho in its entirety, even in the most challenging geographic areas. There is a lot of initiatives that are rolled into the contract, and again, there are going to be a lot of benefits that come to Idahoans as we're working to roll those services out across the state, and everything from supporting the current crisis system, like I said, mobile response teams, bringing up assertive community treatment, other initiatives for children, intensive care coordination for kids, wraparound services for children, intensive home and community-based services. There are just so many resources that we're looking to continue to build on and leverage what's, again, already been done here in Idaho to try to meet the need of Idahoans, and making sure that folks are aware and educated of the services that we offer, and it's not, they don't have to worry about whether they're Medicaid funded or funded or uninsured. They can call a hotline and be able to or meet with their community-based provider, and then that provider can help work with us as we're trying to figure out the best way to serve that participant. So again, an exciting time here. There's lots of work to be done as we're working toward implementation. But again, we've got some great state partners and some great folks on the Magellan team, and again, it's an honor and a pleasure to be talking with you all today about mental health awareness. So I encourage you all to take care of yourselves too. It's really important to get out there, be active, make healthy choices, and make sure to check in with those around you too when you have a moment. I think that connecting with others is a key part of a healthy life. So thank you again. I appreciate the opportunity to speak with you all.
Thank you, David. Up next, we have Alejandra Del Toro and Eden Kuski from Empower Idaho. This is an organization that's responsible for many of the events for Mental Health Awareness Month in Idaho, and they are also responsible for compiling the proclamation that the governor signed a few moments ago. Welcome.
Thanks, Dustin. Hello. We are from Empower Idaho, a local nonprofit based here in Boise. My name is Eden Kuski, and I am the Marketing and Communications Coordinator.
Hello, and my name is Alejandra Del Toro. I am the Program Manager with Empower Idaho.
We are so excited to be here with you all today and to learn more about the Mental Health Month activities and happenings occurring in our community. Empower Idaho serves adults with behavioral health conditions as well as behavioral health providers here in Idaho. We advocate for adult Idahoans' mental health in a variety of ways, such as through our social media, our website, our monthly newsletter, and we also host events for the public, for peer support professionals and behavioral health providers, and in our quarterly awareness campaigns.
So as you all likely know, Mental Health Month is dedicated to eradicating stigma, extending support, fostering public education, and advocating for prioritizing the well-being of individuals and families affected by mental illness. Our largest awareness campaign is the annual statewide Idaho Mental Health Month campaign. Several parts of this campaign serve to change the conversation about mental health in Idaho to one of advocacy, compassion, and understanding.
Annually, we request that the Idaho Governor and the Boise Mayor proclaim May as Mental Health Awareness Month. And once again, Governor Brad Little and Boise Mayor Lori McLean have declared May as Mental Health Awareness Month. And thank you to Brad Little for reading the proclamation a little bit earlier. While Mental Health Month champions advocacy and mental health awareness, this month is also a time for us to come together and be there for each other. This is why our 2024 Idaho Mental Health Month theme is Healing Through Community. This theme encourages Idahoans to build more connections with their community, have more discussions about mental health in their community, and understand that they do not have to experience mental health struggles alone.
A significant part of Empower Idaho's Mental Health Month campaign is our robust toolkit that we've made available in both English and Spanish. It includes social media graphics, behavioral health resources, both statewide and nationally, tips for advocating for mental health in Idaho, and our Mental Health Month events that we have going on in the state. We've finalized this toolkit. It is now live on the Empower Idaho website. Again, there's a ton of resources and ways to advocate for yourself and your loved one included in this toolkit, and we encourage you to utilize that. You can follow us on Instagram, LinkedIn, and Facebook, where we'll be sharing throughout the month. And that toolkit can be found on empoweridaho.org. Okay. This year, our Mental Health Month campaign features art pieces created in partnership with local artist Dana Wagner. Coming soon, we will be offering Mental Health Month merchandise that will be made available for free to the public. We have shirts, cups, lots of really exciting things available. Another exciting part of our campaign is the annual celebration of Idaho artists using art to capture their experiences with mental health. This year, we are showcasing the art submitted to us through Instagram Reels. This video honors the mental health journeys of our fellow Idahoans through artistic expression. So please be sure to check our social media for that video that will be available this month of May. The art showcase videos will be posted in May, as I mentioned, on our social media. We also give out Mental Health Month Advocate Awards throughout the month. Annually, Empower Idaho partners with the 7 Idaho behavioral health boards to recognize a mental health advocate in their region. The board selects an individual of their respective communities who exemplifies community advocacy, resiliency, and passion for mental health. Each advocate works to embody these qualities and deserves acknowledgement and celebration. We give out award letters and certificates to each advocate and are always very happy to see what everybody is doing to accomplish wonderful things in their communities.
We also celebrate Mental Health Month by hosting an Idaho Mental Health Month community calendar on our website. So this calendar is a space to keep track of and to showcase events happening throughout Idaho that celebrate Mental Health Month. You can access this calendar by going to our website, empoweridaho.org/calendar-of-events. If any of you are hosting any Mental Health Month events or activities this year, you can submit them to us by emailing empoweridaho@janus.org. That's JANNUS for Janus, and we will submit them and put them on our calendar. In these emails, we kindly ask that you include the following event details. So who is hosting the event, when, where, who the event is for, event details, so what will be happening at your event, cost to attend, where people can go to learn more information, so like a flyer, a person to reach out to, website, etc. And then where people can go to register if the event requires prior registration. All year long, Empower Idaho focuses on mental health advocacy, such as by hosting mental health events for the Idaho community. We have a few additional events happening in May. The last session of our first peer support conference of 2024 is Peer Support Scenarios, Boundaries, and Dilemmas, and Risk Management. This event offers 3 CEUs for peer support and recovery coaches, and is on Zoom next Wednesday, May 9th, from 10 a.m. to 1:15 p.m. Mountain Daylight Time. If you want to register, you can visit the Peer Support Conference page on Empower Idaho's website. We also have a couple of May events for the general public. Our Using Your Body to Calm Your Mind event is on Zoom on Wednesday, May 15th, 2024, from 6 p.m. to 7 p.m. Mountain Daylight Time. This event is focused around yoga. I love yoga, maybe you guys too, so make sure to tune in. And then we also have our Spanish QPR event on Zoom on Wednesday, May 29th from 12 to 1 p.m. And this event is presented completely in Spanish. You can register for both of these events by visiting the participant and family member education page on Empower Idaho's website. Thank you everyone for your time, and for the Department of Health and Welfare for letting us speak today. We are so excited to celebrate Mental Health Month with you all this year.
Yes, thank you all.
Thank you.
Thank you, Eden. Alejandra. Up next is Rick Huber. He is a Rupert native and a member of the Idaho Behavioral Health Planning Council. This is a group of invested public servants that promotes advocacy, collaboration, education, and policy development in the Idaho behavioral health delivery system. Their mission is to cultivate and support healthy lives and communities in Idaho. The council consists of community members from many corners of the care continuum, members of the judicial branch and corrections, to advocates for housing, disability rights, vocational rehab, education, and as well as Idahoans in recovery from mental illness, substance use disorder, and from repercussions of suicide. The council works on complex issues that affect everyone in Idaho, no matter how far removed they are from the casework. And we sincerely thank you, Rick, for coming today.
Well, thanks for having me. Obviously, I came prepared. I don't have any notes or anything, and I was asked to talk a bit about the Planning Council and share a little bit of my personal experience and why I'm involved. I would just say that the Planning Council was first started back in, I believe it was around 1982, as a result of the federal government putting forward mental health block grants. So with those block grants, the federal government required states to have a planning council of citizens to basically tell the state how they would like to see them spend these federal monies they were getting. So that's kind of what started it. It was also in a governor's proclamation, and I believe it was Governor Andrus that did the first proclamation. Don't quote me on the facts because I'm in the ballpark anyway. But I have personally been involved with the Planning Council for a little over 25 years now, so I was first appointed by Governor Brad, if anybody remembers him, or what, I'm sure even some people weren't even born then. But anyway, I've been involved for many, many years. I'm very proud of my service on the Planning Council. The Planning Council has been instrumental in, for example, bringing forward having clinicians based in our juvenile justice centers so that they can get assessments and get some mental health treatment or substance use treatment rather than being incarcerated. And it was very heartwarming this last meeting to find out that over the years now, the number of kids in our juvenile corrections system has dropped tremendously. And I would like to think that maybe putting those clinicians into the centers kind of got the snowball rolling in that direction. My hope is in the future we can do the same for the adult corrections system as well. So I guess I will tell you how I first had my first mental health experience. I was a student at the University of Idaho in the engineering program. At the time, I was at home earning money to go back to school, when all of a sudden it's like everything just blew up and the world was turned upside down. I started seeing things that weren't there. To me, they were, obviously. And if you haven't experienced it personally, it's very hard to explain. You know, like watching The Exorcist would probably be a very good way to describe it, because it's like 1 minute you're okay, and then it's like somebody just takes a spoon and stirs your world up and everything doesn't make sense, and sometimes you don't remember. And of course my folks were unaware of what was going on and desperate and didn't know what to do, so they took me to an alcohol treatment facility. Well, needless to say, I didn't get any mental health treatment there. So I continue to decompensate, become very, very paranoid, scared, frightened. So I ran away from that facility and made it, I don't know, a few blocks, and two police officers approached me. And at the time, I had an innate trust of police officers because they're the good guys. So we walk probably about from here to that wall, and each of them grab an arm and twist me up, throw me over the back of a car in the middle of the summer, burnt the whole side of my face. First time I'd grown a beard because my side of my face was a big scab. They carry me with my handcuffs. They pick me up and carry me. Definitely a very painful experience. Carry me back to the treatment facility, throw me in the back of the police car, which back in those days, not to age myself, but it was like 1981, I believe, 82. It was 82. And at that time, they were taking me to jail to go to court for commitment until one of the staff from the treatment facility come running out. Wait, wait, wait. He has insurance. And it's like you flipped a switch on those officers and they're like, oh, we're sorry for basically beating you up. And I'm like, so that was my first experience with the disparities of mental health. Once they found out I had insurance, it was like I was a total different person in their eyes. So we sat there for maybe 5 minutes. An ambulance came. They took me out of the police car and out of the handcuffs, put me in a straitjacket, and I went to the medical hospital for like 4 days for treatment. So right there is what really inspired me to become an advocate. I ended up working several different jobs until 1991 when I had another episode and ended up on disability. And then a few years later, I started on this journey of volunteer work and working with the Planning Council. I would also like to say that right now, I'm very, very thankful that Idaho has Medicaid expansion. And we can thank basically all Idahoans for that because it was the voters of Idaho that got that into place. Unfortunately, now our mental health services especially are very dependent upon this Medicaid expansion. So I pray that you encourage our legislators to not work to end Medicaid expansion because especially for mental health, it would be very, very devastating. Not only that, it doesn't make economic sense. Right now, when we provide mental health services and substance use services, there's more availability of Medicaid paying for these, so we basically have the federal government paying for 70% of the services. So obviously it makes sense to do so. In the past, many of these services ended up, the state had to pay for them 100% because the people needed them anyway, whether they were on Medicaid or not. So I would really like to stress the importance of Medicaid expansion here in Idaho. So I would also say that, yes, the Planning Council has some control over how the federal block grant dollars are spent. It's basically an advisory position. So we do our best to try to look at some of the great things that are happening across the nation, especially, and go, hey, you know, maybe we could try this here in Idaho. Can we take a little bit of the block grant dollars and have a pilot project, which is how the Planning Council has helped shape the mental health and behavioral health system here in Idaho. So we do our best, and we have to be over 50% basically regular citizens, people that are not providers or government employees. So I'm very, very proud to be a part of this group, and I will continue probably for as long as I can, I guess. I've thought about retiring, and then everybody's like, no, you can't do that. So thank you very much.
Thanks, Rick. Thank you, Mr. Huber, for speaking today. Our next guest is Beth Markley, the Executive Director of NAMI Idaho. That is the National Alliance for Mental Illness, a longtime partner of the Department of Health and Welfare and an organization of families, friends, and individuals whose lives have been affected by mental illness. Welcome, Beth.
Thank you. And thank you, Rick, for sharing your story. That was really moving. I appreciate that. Again, my name is Beth Markley. In my role as the head of the state organization for the National Alliance on Mental Illness, I do a lot of presentations this month for Mental Health Awareness Month. And I get questions sometimes, or I get people saying, isn't it great that mental illness stigma isn't as much a thing anymore? And as you heard earlier, there are some things that have improved for folks with mental illness. And in a lot of ways, we can talk about mental illness in a way that we haven't been able to in the past. But I will be clear, stigma is a very, very real thing. And I'll share a couple of stories with you to kind of bring that point across. If you don't deal with mental illness firsthand, which I know a lot of the folks in the room here today do, you might be tempted to think it's something, mental illness is somebody else's problem. Statistics tell us that mental illness is probably closer to each of us than we want to realize. For folks with mental illness, 50% of the symptoms, or 50% of people with mental illness, their symptoms will start showing up as young as 14. And about 75% of the time, it's diagnosable by age 24. So for many families, the first mental health crisis they experience is that of a child or a young person. We know that 1 in 5 people will deal with a mental illness this year. Most often, this is going to be anxiety or depression. For 1 in 20 people, they're going to be dealing with a serious disorder like schizophrenia or bipolar disorder or borderline personality disorder. And 1 in 20 might not sound like a lot, but if you consider this in the state with a population the size of Idaho, that's like a city the size of Meridian or Nampa that's dealing with a very serious mental illness. And I want to talk a little bit specifically about stigma in the workforce, because I'm talking to folks about that. And to be clear, mental illness has been a problem. It's been on the rise even before the pandemic. The World Health Organization says that mental illness in the workplace is a $1 trillion concern. $1 trillion is lost every year annually due to decreased productivity attributed to mental health concerns. And worldwide, depression is the leading cause of disability claims. NAMI recently completed a new workforce mental health poll, and the statistics tell us a really important story. They say that 74% of employees say that it's appropriate to talk about mental health at work, which is a good thing, right? About 58% said that they would actually feel comfortable with reporting, because what they fear is job loss and derision and judgment. And those, just fear of something big and scary and how people will respond to them. I want to share a story about this. I'm a part of a online group of executive directors, and this is nationwide, and they're all different, groups and all different concerns and nonprofits. And one person recently shared that she had a problem. She's somebody who lives with a mental health disorder for reasons that were not her fault. She was not able to get her medication for a couple of weeks, and she felt like her work performance was impacted by this. She wasn't getting to emails quickly. She was in a fog. She was having a really hard time. And this is what she said. On one hand, I want to be able to share with people at work that the situation was due to an inability to get my medication. However, I don't like the stigma that goes with that, and I don't want people to have a perception that I'm only good at my job because of my medication. Here's the thing. We can and we should, as leaders in our community, talk about mental illnesses and the issues that come up as medical issues, because they are medical issues. If you came across somebody who fell down on the street and that they were in distress, and maybe they broke a bone or they hit their head and they're bleeding, you wouldn't say, "Oh, I can't deal with that. I'm not a professional," right? I'm not a doctor. I can't set a broken bone. You wouldn't say that. That's ridiculous. You would say, "Oh my gosh, what can I do to help?" You would make sure they were stable. You would stay with them. At least I hope so, until there was help. Who can I call? Should I call an ambulance? Is it that big of an emergency? Can I get you to an urgent care provider or something like that? That's the same thing that you should be thinking about in terms of mental illness. The problem also, if we're talking about the numbers, and when Rick was sharing his story, the people who are impacted are not just the people who have mental illness, but for their care providers. So with the number of people that we're talking about statewide that are impacted by mental illness, and the people who are caring for them, and given that a lot of these folks are young people, that's a big number of people who are caring for them, at least until things are stable. Chances are in the workforce, you are coming into contact with people every day who are dealing with this issue. And I want you to think about that, because in so many places of work, we have people who are going to circulate a card, a get well card, if there's somebody who's who's had a baby or who's sick, right? If someone suffers from something catastrophic like a house fire, maybe they're organizing a GoFundMe or some sort of clothing drive, right? We kind of joke about this in mental health circles that mental illness is not a casserole condition. And what we mean by that is, there are so rarely meal trains for mental health crises. And that's what stigma is about, right? So you are probably coming into contact with somebody who is dealing with maybe they're bleary-eyed because they spent the weekend with a teenager with suicidal ideation in the emergency room. Or they can't sleep because they are noticing things about a loved one that's going downhill, and they can't figure out what to do about it. And you just heard that every single county in Idaho is a federally designated resource shortage area. So sometimes it's not really clear what they should be doing to help with that person. So with regard to the person who was dealing with a mental health issue and not being able to get her medication, we can talk about these things. We don't have to be completely forthcoming, but we can create a culture where it's safe, where people feel like they can come forward with their mental health issues. Leaders can set the tone, and they should. You can ask people, how are you really? And you can be okay if the answer is not tidy, right? You don't have to fix things. You don't have to be a medical doctor. You don't have to be a therapist, but you can listen without judgment. And if there's a way to, help that person that's really clear, maybe you can do that. You can call 988 on behalf of someone and sit there while they get the resources that they need. I actually was just doing a presentation to 140 people in a particular industry just this week, and I said, how many people know about 988? In 140 people, there were probably a half dozen people who raised their hands. We probably all know about 988, but don't assume that other people do. And don't assume that they're comfortable calling it, even if they do, because they're like, I'm not suicidal. That's not for me. But you could be there with them to call. So that's why we have a mental health awareness month. We can talk about mental illness. We can talk about the toll it takes on a family, on a community, and we can fight stigma in that way. What else can we do? We can know the signs of what's happening. I mean, if you notice that somebody is going through something over a period of more than 2 weeks, their appearance is deteriorating, their performance has taken a nosedive, you can sit down and ask with them. These might be indicators that something's going on. You can, you're not going to plant the thought in their head if you ask if there's something going on, right? You can sit with them while they call 988. You can talk to them about who else can we get to help you. I think as a community, we can work together to make a difference, and I think ending stigma is really that first part of it. So happy Mental Health Awareness Month, everyone, and thank you so much for being here.
Thank you, Beth. You make a really great point. When we talk to people at the Idaho Crisis and Suicide Hotline, they say it's okay to call 988. Don't be worried about it. Sometimes it's good just to go and make the call to test it, to make sure that you're comfortable when that emergency arises. So perhaps you may not need it right now, but it's good to get comfortable calling. So when you find somebody in crisis, whether it's you or somebody else, it's good to be comfortable to know when and how the process works. So when the crisis actually does occur, you're ready for it. Thank you for that, for speaking again. We have up next Representative Chris Mathias. I'm not sure if he's in the room yet. Might be running a little bit late. If so, we will move on to Brenda Wilson with FYIdaho. FYIdaho is an organization focused on helping children and youth in Idaho heal from illness, trauma, and the complications of growing up in this state. So, welcome.
So I had this whole thing planned about being last, and we're gonna still pretend that I'm last, that I'm at the end of the agenda. So for this, we're gonna go and have this moment together. So once again, yes, my name is Brenda Wilson. I'm the Executive Director of FYIdaho, or Families and Youth of Idaho. and I want to thank all of you for being here. I see so many people that I know and have worked with in the past. It is such a special gift. So thank you all for being here today. Thank you to all the people who are online watching us, and thank you for all of you who are watching TV the old-fashioned way. It still exists. So what I want to do is I want to talk a little bit about when is it good, and this is interactive. So just a side note, I used to be a school teacher. I know what it means to need to move around, to be interactive and to work together to come up with answers. So I want you all to put your thinking caps on, because this is where you get to be a part. Ooh, I see people doing it. Good job. So I want you to think about, when is it best to be last? So just think for a second. When you know, raise your hand. What's that? White elephant gift exchange. Yes, because you're the winner. Nicely done. Very good. Who else has an idea? When is it good to be last? Yes. In a relay. Yes, because you can just run, and win the prize. When else is it good to be last? Nice. You always go last, right? You got to know what everybody else is doing. Well, when is it not good to be last? Ooh, eating's not a good time to be last. Is it cold sometimes? You get all the leftovers. You don't want that. What else? Why do you not want to be last? Or when is it not good to be last? Yes, sir. Yes, ma'am. Wow, nicely done. If you're in a line to get away from a fire, you do not want to be last. Nicely done. Good job. Well, I'm going to say one thing about being last. And one place it's not good to be last is in mental health. And all of us know that Idaho may not be exactly last, but it's pretty darn close. So that's why we're here today. And all of you are here today to help move us up so that we're not last anymore. So that's what I want to talk about today. And I want to kind of put this in an analogy, again, the school teacher brain of mine, so that you can kind of see what it means to be able to work from maybe being last as a bad thing to actually hitting a grand slam or a home run or even just bringing in a batter. So if you think about baseball, if you are in the bottom of the ninth, 2 strikes, and you're the batter who's coming up, how do you think you feel? You a little nervous? Yeah. You're last, maybe. I mean, if you strike out, it's over, right? If you have people on base, you might be able to just get the runs in and perhaps win the game, right? But you know what you are when you're last at that bat? You're providing hope and a chance to win, right? So that's what we're all here for. So I want to talk a little bit about how FYIdaho, or Families and Youth of Idaho, is here to provide that hope for you. So when we all leave these rooms today, we are empowered and ready to go to make that difference in the world. So I'm going to tell you a little bit about who we are, what we do, how you can participate, and then we're going to talk about what we're going to do when we leave here today. So Families and Youth of Idaho is put into 2 categories. We work with families, caregivers. Now let's think about this. Families have changed. What family looks like now is much different than what it used to look like, right? So when it says families, I want us to think broadly. Families, caregivers, those who interact with our youth and are responsible for them. So what we have on the family side is our family support line. It is a free line that families, caregivers, and all of the above that I just spoke of are able to call and get some help. Now what they get help with is navigation. So we help navigate families and caregivers through the mental health process, steps that they're having to take in order to go through the systems of care, the continuum of care, just so that we have a hard enough time navigating it ourselves, right? Yeah, I see heads nodding. Good participation. But I also know how hard it is to do it by yourself. So we are there to help navigate. We're also there to help educate. Now, this is a little bit broader. We educate families, caregivers, and those who need our services as to what's out there. How do you access them? But we also take a very, very, very special pride in the fact that we get to educate people in the community about who we are and how to make a difference in this world when it comes to mental health and how we can make a difference. So that is our education part. So we navigate, we educate, and we advocate. We advocate on behalf of the people in our state that need our help the most. And so those three things are the big values, the mission of what FYIdaho does. And on that family side, a family member can call our family support line and they get navigation, education, and advocacy all the way through. So that's the fun part on the family side of things. Now remember, there's the Y, and what does Y stand for? Good job, youth. Fantastic. So on the youth side of things, we have an amazing opportunity to engage with individuals, with our youth, through the Boise Brick House. How many of you have heard about the Boise Brick House? Very nice. We're located downtown Boise, walking distance from Boise High School. We are here Mondays, Tuesdays, and Wednesdays after school for kids to have a safe space, have a place to just be and enjoy each other's company, and have an opportunity to work with mentors. Now, I'm lucky because I have people from our organization here today in the audience, and how special it is to be able to have the people who work with our individuals, with our families, and with our youth here, to really be able to help participate and see just how amazing this is to see you all here. So thank you for being here today. So special that you got to participate in this. So what I want to talk a little bit about with regards to the youth is that we know the youth is our future. We know the youth know if we're in the back of the line for a fire, we're kind of in trouble, right? Yeah? So if we're in the back of the line, if we're last here in mental health with kiddos and adults, we'd better figure out how to get up front. And the way we do that is have events like this and have all of you who are supporting us today be a part of that. And we are already way ahead of the game now, seeing all of you here. So we have our families, we have our youth, and we have all these different activities that we get to participate in. Now here's the fun part. Who knows what next week is for Mental Health Awareness Month? There's some special little thing that's, somebody knows. Children's Mental Health Week. Yes, there's a whole week dedicated to all these kiddos. And if you haven't noticed, the Capitol building is full of them, right? I remember myself going on field trips to the Capitol building and being the teacher providing the field trip. So I see all these kiddos here and know, oh my gosh, guess what? There is a week specifically for you, for us to be aware and to understand the very unique things that are happening in our communities with our youth. And you have to remember, the youth is going to grow up and be the grown-ups and the family members. So if we can start now, we have the opportunity to really affect change and empower people to make the policies and to make the programs and work really, really hard in order to be successful in our future. So with that, I have two things to share. Next week at the Boise Brick House, and we have flyers that we can send out, we have our Children's Mental Health Acceptance Week Festival. And what that means is that you can come to our facility, our Boise Brick House, between the hours of 1 and 6. You get to meet community providers, families, and the youth that we serve. And that would be a fantastic opportunity for all of you to be there and to help support our wonderful community. Now, I'm going to close with a beautiful letter that was written by the kiddos that we serve over at the Boise Brick House. We at the Boise Brick House want to show you our appreciation and gratitude for this special community. This place gives us the ability to bond, have fun, and enjoy the company of others, regardless of school, gender, ethnicity, sexuality, and background. Thank you, the kids of the Boise Brick House. And for them, this is for them, right? So I want to say thank you all so very much for being here today. Thank you for letting me, as another baseball analogy, close it out. Get the home run for all of you, because you're going to go out now and you're going to act. You're going to go out and advocate. You're going to help people navigate. You're going to educate as to things that are happening in this world that is fantastic and beautiful and unique and different. And you are all going to make a difference in the way that we look at mental health, how we accept what's happening, and do something about it to make it better. So with that, I want to say thank you all for being here today. Thank you for letting me be here and take your time and share a little bit about what we do at FYIdaho. And I have to say, y'all made my day, so thank you.
Thank you so much. So we have one last speaker today. Representative Mathias is outside on the phone real quick. I'm going to fill real quick. This is a great time to talk about some of the things we do at the Division of Behavioral Health. We have this new communications team, and we are presenting things like this. We are going to events like at the Brick House next Wednesday to cover them for communications, to share the good word. And we also have a podcast. It is called the Idaho Behavioral Health Authority podcast. You can search for that on YouTube and on Spotify. We've done a couple of interviews so far. We interviewed Brenda, and we interviewed Alejandra. So it's a monthly podcast, and it is available on, like I said, on Spotify and on YouTube. We're going to be doing more and more things over the next few months. We went to the Forensic Clinical Conference last week and just did these neat little interviews with the keynote speakers and the people who are in attendance. So it's just a nice little extra media pop for us to just to share the ideas and the mission of the Division of Behavioral Health and to share stories. There's a lot of people who are doing work that you'll never see. There's a lot of people behind the scenes at DBH who are clinicians, and they are people who are monitoring contracts that you'll just never see their faces, but they are doing work. They're making sure that the behind the scenes work gets done so that the care that people get when they walk through the doors and they call and they ask for help, that work is actually available and it's accessible and it's worthwhile to the people in Idaho. So please check out the podcast, check out the behavioral health newsletters. We put out 2 newsletters, the DBH newsletter and the YES newsletter. That's for Youth Empowerment Services. Those are quarterly. So you can search for those online and get more information. There's a lot of stories in there. I end up writing a bunch of them, but we also will work with Empower Idaho to continue to share calendars of events. So anytime that there is something that is going on in your life, in your town, wherever it is in Idaho, please let us know. You can send us an email to bhcommunications@dhw.idaho.gov, and we will transfer that information to the public. So please send those emails and continue to participate. And with that, we have our last guest, Chris Mathias from District 18B here in Boise. Welcome. Yeah, come on up. Thank you.
Thank you.
Hi, you're welcome.
Hi, everyone. I am extremely nervous, but I'm not nervous because I'm afraid to talk. I'm nervous because I'm usually accustomed to talking about this subject matter with people that know less than me and not people that know more than me. So I apologize that I'm going to read a little bit more than I normally would just because I want to make sure that I get this right. And I think we're going to have enough time for some questions. I hope there's some questions afterward. And I'm really grateful to you all for having an elected politician come and speak. Very brave of you, but I hope that by the time I'm done, by the time that we're done, that it was worth your while. So my name is Chris Mathias. I represent District 19. I sit in House Seat B. So this is District 19, downtown Boise, up to Bogus Basin in the north, Harris Ranch in the southeast of my district, and Avamore up in the northwest. So by urban districts, it's a pretty big district. And this story for me begins in the first couple of weeks of the pandemic, right when everything started getting shot down. And those of us who had, at the time I had a 4-year-old and a 7-year-old, and we spent a lot of time at the park, And I ran into someone, a constituent of mine, who I hadn't seen in some time. Both of our oldest sons had been in preschool together. And so we were catching up. We hadn't seen each other in years, and we were catching up. And she proceeded to tell me about a condition that her older son had been subsequently diagnosed with and that their family had been struggling with. And so I listened to the story, and at the end, and at this point, I should say I had won my primary. So this is like June of 2020. So I'd won my primary in a safe district for my party. So I was preparing to get elected, and so I was starting to ask everyone I saw, what do you think about this? What do you think about that? And besides residential property taxes, there was always something else, but everyone wanted to talk about that. And so she told me about this condition called PANDAS PANS, and I'll talk about it in a second. And I said, well, what can I do? And she said, Chris, nobody knows anything about this. It was a little bit of hyperbole. There was a handful of people. There's about 2,300 children in Idaho who suffer from PANDAS PANS. They know about this. Their families know about this. Their providers know about this. But she said nobody knows anything about this. So it would be great if there were a little bit more awareness. And I said, awareness is something that I can do. And so let me back up, and then I will come back to the awareness. And so as I mentioned, PANDAS and PANS, which stands for, by the way, and I won't read the acronym, but what I will tell you is that PANDAS and PANS are post-infectious neuroinflammatory disorders. For lay people like me, what presents as an infection, strep, actually is an infection in the brain, and it causes an abrupt onset of symptoms, including obsessive compulsive, bipolar, tics, eating restrictions, due to, and I want to make sure I get this right, a misdirected immune response to an infectious trigger. So what seems like a totally normal and happy child comes down with a fever, might get a sore throat, the fever goes away, they seem like everything's okay, but then all of a sudden they have all of these rapid onset secondary conditions and nobody knows where they came from. A host of other symptoms can accompany these, including rage, deterioration in math and handwriting, separation anxiety, sensory sensitivities, emotional lability, rage, impulsivity, depression, even suicidal ideation. I said there are about 2,300 children in Idaho who suffer from PANDAS PANS. That's based on the fact that about 1 in 200 kids suffer from this. All 2,300 have not been diagnosed. And that is a problem that I'll talk about here in a second. Now, unfortunately, most of these children are misdiagnosed as having some sort of psychiatric condition. That's probably the biggest problem, and it's probably one of the biggest reasons that I've become such a proponent of raising awareness of this, because these are not psychiatric conditions. They're overlooked often and dismissed by healthcare providers, and this lack of awareness and recognition leads to prolonged suffering, potential brain damage, issues with the justice system, and sometimes suicide. And I feel like it's increasingly becoming suicide. The state of Arkansas, this is not something we've done in Idaho, but in my research, preparing for the legislation that passed this year, the state of Arkansas in 2023 passed a bill requiring healthcare insurers to cover a particular type of treatment called IVIG. It's a type of immuno replacement therapy for the most severe cases of PANDAS PANS. Not all insurers were covering it, so the state of Arkansas mandated it. We talked about taking that approach this year, but a health insurance mandate hasn't passed this legislature since the 90s, and so given my standing in this building, that wasn't a battle I had the capacity to take on. So what we did this year is we passed a resolution. Again, I'll talk about that in a second. So that's kind of the state of things. PANDAS PANS is not a psychiatric condition. It is the impact of infectious trigger, misdirected immune response to an infectious trigger. So diagnostic and treatment guidelines have been published, so our medical professions know how to learn. Our professionals know how to learn about what these conditions are and how to treat them, how to provide medical treatment that's indicated, such as anti-inflammatories, steroids, and IVIG. Now, these kids need medical treatment. That's what these kids need. They don't need counseling, they need medical treatment. And they need to address the brain inflammation responsible for their symptoms. And like I said, they're medical disorders that present with psychiatric and movement-based features, and awareness is necessary to distinguish them from other mental health disorders. Dr. Sue Suedo, who's prominent in the field of raising awareness among the medical professionals about PANDAS and PANS, is widely known as saying, quote, "Children should not be healthy one day and psychiatrically crippled the next day." So we hope, and I'll talk about who I mean by we in a second. We hope that you will join in our efforts to raise awareness here in Idaho, in our local communities, because we're very lucky to have a dedicated nonprofit that is providing free education to people, to families, to organizations, to medical professionals. The Northwest PANDAS Network, who I lean on heavily. They're probably tired of getting, in fact, I just called them today just to thank them for some things and see if there's other things that I need. They're probably tired of hearing from me. I call them all the time, but I'm extremely grateful to them because they don't only help me, they provide free information, education, and counseling to anybody who wants it, Here's what they've been doing with me specifically in my role as a legislator the last couple years. So I came away from my meeting with my constituent in the park, and in 2022, with then Representative Lori Likely from District 26, I think, we passed House Concurrent Resolution 31, I believe. And what that did was designate October 9th, 2022, PANDAS Awareness Day. In 2021, the governor's office made that declaration. Last year, the governor's office declaration, and this year, House Concurrent Resolution 27, which passed the legislature, also designated October 9th PANDAS Awareness Day this year. But we also went one step further. This year, House Concurrent Resolution 27 also tasks the Department of Insurance to assist in ensuring that the costliest treatment, IVIG treatment, that treatment for these disorders is available to any insured kids. There are children in Idaho who have been properly diagnosed with PANDAS, have been properly diagnosed as having severe cases, and have been identified as being ripe candidates for IVIG treatment. Most insurers, from public and Medicaid side to Select Health on the private side, they cover IVIG treatment, but some don't. The CMOs at some health insurers still think that this treatment is experimental. And so what we did this year is we passed House Concurrent Resolution. What the Department of Insurance is doing, and I'm extremely grateful to them, and I should say I'm pretty biased. I used to be a state employee. Well, I'm still a state employee. I used to be the chief academic officer for the State Board of Education. So 24/7, all the time. I really appreciate what our state employees do for us. They get almost none of the glory. They get almost all of the punching down, and I really do want to thank them. And the Department of Insurance has been extremely great in this effort. And I should back up. One of the reasons we wanted to take this approach, this kind of private negotiated approach, is because it's been pretty successful in the past. In 2018, the Department of Insurance adopted this approach to get hearing aids for children who are hearing impaired, to make sure that their hearing aids are covered by private insurers in Idaho. And all that took was getting all the CMOs in the room and getting them to agree and update their policies. They did that again in 2021 with a particular type of infant formula. And so we thought that that seemed to be a pretty solid model that we are using again this year. And the Department of Insurance has been great. So in addition to PANDAS Awareness Day on October 9th, we're also in the process, and we've just gotten started, to figure out what do we need to do to make sure that children and families that are already insured are getting coverage from their health insurers, making sure that the essential treatment is covered. I guess at this point, let me just stop and say this. If you know someone who has a child that you think might be experiencing something like this, even if you know someone who has a family member, a child who one day seemed fine and the next day they were definitely not fine, this might be the help for you. This might be the awareness you need. And Northwest PANDAS Network is fantastic in providing advocacy, support, help, plugging you in with similarly situated families so that you have other people to rely on. And I cannot tell you enough how many of these families I've talked to that are extremely grateful to them. They're extremely grateful to the legislature for raising this awareness. And now I'm here asking you all to help spread some awareness on this front. So with that, if there are questions, I'd be happy. I know we're not short on time, and I apologize for my tardiness, but I'd be happy to answer any questions that you might have. Yes, and I apologize for that weird, awkward pause when I'm asked questions in this room. Usually I have to wait for the chair to acknowledge me, and so I'm accustomed to the processing pause. So yes, the vast majority of the time they do. IVIG treatment it's It's an outlier in the sense that it is reserved for the most severe cases, and its efficacy is dependent on the severity of the case, the size of the child, the frequency of the treatment, and things like that. But it almost always, and the literature bears this out, it is almost always effective in reducing the severity of the symptoms and getting some of these kids back onto a track where they can just live their normal lives. During some of the testimony that we heard during House Concurrent Resolution 27's trajectory through the building this year, we heard stories about kids who won't even put clothes on anymore, kids who haven't been to school since last school year. I mean, it's pretty crippling. And it's crippling in the context of, on Monday, I had a totally normal, happy, productive child. They had a fever this weekend, and now they have obsessive compulsive disorders, or they won't eat. And this stuff, for those of you who are parents, can be extremely discombobulating and frustrating. And the more you learn about this, especially if you find out your kid has been misdiagnosed, it's extremely problematic. And it doesn't need to be that way. Northwest PANDAS Network is here to help. There's a lot of information. The literature and the research on what pandas and pans is and isn't is growing rapidly. And I'm really grateful to the Department of Insurance for their willingness to help us kind of navigate this. The thing that brings me a lot of hope is that the N size, the number of kids that we're talking about, so if there are 2,300 kids in Idaho, only about 20% have the most severe cases in which IVIG is necessary. So that's about 430 something kids. And of those 430, 90 are insured. And of those 400, the majority of their insurers cover IVIG treatment. So we're talking about less than 100 kids in Idaho who are covered, but they're insured, but their insurer will not cover IVIG treatment. So if we can get treatment to them and make sure that it's covered, the number is so small that it shouldn't affect premium rates throughout the pool. And that's one of the things that keeps me really optimistic that this is going to get to the finish line by the end of the calendar year, which is what the resolution is asking for the Department of Insurance to get this done by. Great question. Yes. Oh, there was another one back here. We'll go right here, and then we'll come back here. Well, if you would have asked me that question a couple years ago, I would have said, I don't know. But I will start by saying just this, normalizing the presence of people who can speak about this. And there are people in Idaho who are more knowledgeable on pandas and pans than I am, but just including us in conversations like this, allowing us to set up tables and booths at places where families who are trying to care for sick kids might congregate, talking to healthcare providers about this. If you or a family member or a friend or a neighbor might be experiencing something like this, because there are a lot, and now I'm going to get a little outside of my comfort zone, and is this being streamed?
Yeah.
Okay. I'm still going to say this, I'm just going to think about how to say it a little bit more diplomatically. When you get the insurers in the room, and I have not been in the room with them, but this is just my suspicion. When you get the insurers in the room and you ask the CMO at Select Health, why is IVIG treatment covered? They will say, well, you review the literature and it's pretty clear that this is no longer experimental, that the efficacy rates are so high, the ability to treat makes sense, it's not gonna drive up costs. The holdouts, the insurers who are the holdouts, probably have CMOs who have been in their positions for a long time and aren't exactly in the business of reviewing the emerging literature on things like this. And so back to the question, one of the ways that we can help these families in raising awareness is by raising awareness with people who are uniquely positioned to do something about it. Primary care physicians, a psychiatrist who's probably wondering, why is this kid here? This kid doesn't have psychiatric issues. This kid has, an inflamed brain and needs steroids or something like that. So talking to people in the field who have contact or might have contact with these families is probably also very helpful. And again, I'm really grateful for inclusion today. From my understanding, it very rarely is a one and done. But it also is not an indefinite. I think there's a cycle of treatments. I've heard, the most I've ever heard is, I think, 7 treatments. But I don't know over what course of time. I don't know the amount of each treatment. I just know that usually it's a series of treatments. And again, that's just for IVIG, which is reserved for the most severe cases. The most cases are not the most severe cases, and so I think those are closer to one and done, though not necessarily. You're welcome. Yeah, there are lots and lots of resources. So I would point you all to Northwest PANDAS Network website, which can be found at, of course, when I printed it, www.nwppn.org, nwppn.org. There are a lot of Idaho families who are part of the network. It's self-support for them, but it's also direct access to people who are keeping up on the literature, people who can consult with them when they're going through this, people who can help them when they're getting a denial letter from their insurer that doesn't make any sense, that's telling them that this is experimental, but they know someone in the network who got a letter from another insurer that says this is not experimental and we'll cover this. I mean, that kind of information in real time is extremely frustrating for these families. And so the Northwest PANDAS Network is the go-to resource, not just for emotional support, but for technical support, medical support, and making sure that, if they can't help you, they will put you in a place or in contact with people who can. Oh, thank you. That's a great question. When it comes to PANDAS PANS, yes, though I'm not sure if there is a corresponding condition for adults. But PANDAS PANS is unique to minors, yes. Something I'm curious about. Any other questions? Okay.
Okay, seeing none. Thank you again for
Appreciate
coming.
it.
And again, I'd like to thank everyone for coming today. Some big takeaways. You're talking about a small population with this illness. And a lot of things that we work with in mental health are small populations. But to the families and to the children and the adults involved, it's a huge deal. And you may not notice it. We heard earlier about how when you're walking down the street, you might not notice somebody who's suffering from one of these conditions. And that's what awareness is really about. It's awareness and acceptance. And maybe sometimes you have to ask the question and see if somebody needs your help. And a lot of times you just have to accept that somebody's in a situation and you shouldn't, offer judgment to them anyway. Offer acceptance instead. And just to be aware that people are working towards goals to get better and to provide these services, and that you may not know what someone is suffering from. So be accepting, be aware, and just be kind to your friends and neighbors here in Idaho. And with that, I'd just like to thank everyone for being in the audience today. Make sure to grab some of the stuff at the back door. We have lots of fun things for you to take home with you. And again, thank you all for coming.